individuals when they're faced with a combat scenario. This has triggered things like, random self-defense scenario, arguments, street fights. Sometimes, to a lesser degree, it's triggered by tournaments or just anything where there's a lot of stress going on. Okay, so the base of the presentation is that combat or a combat scenario has predictable effects on the human body. The physical effects that happen to everyone are pretty much the same, but the mental effects happen in a range that varies from person to person. So that's something to keep in mind. I consider a combat scenario is something where there's the fear or threat of injury to yourself, or that you have to commit an injury to another person. So it's also triggered by when you think you have to do something to someone else. This effect can be managed and mitigated through training and awareness of the effect itself. It's often really disorienting when people experience it, and they have only been experienced through combat through such like TV and movies. So when you actually feel it yourself, it's very disorienting. So it's just good to be aware of that. A complete martial arts system is going to recognize that these changes occur, and it's going to take them into effect when you're training or doing tournaments or just structuring your martial art. So a little bit of background on myself. I'm Nikolai. You all know me from here. I've been doing martial arts for 16 years, and I've been doing the AES for 11, so the vast majority of my martial art experience is in this club. I've been in the hospital security industry for almost a decade. So I've been in a few fights, not a lot. I haven't had to kill anybody. Everything I talk about in this, I've either experienced myself or I've observed it happening. So I do believe in what I'm presenting right here. And I've always been interested in just martial arts and fighting. So that's myself there. David Grossman, if anyone's read his book on killing on combat, he refers to taking a life or hurting someone as a universal human phobia.
Unless you're a psychopath.
Way to get ahead of my station there. So almost everybody, so probably everybody in this room is going to feel some sort of stress in an interpersonal aggression with someone else, either to or from. If you don't feel that, you're a sociopath, and you're beyond the topic of this presentation. So this stress response has evolved over millions of years, and the most simple way I can explain it is that enough of your ancestors experienced this response at some point, managed to stay alive, and then managed to reproduce. So everybody that is here today, that is in your evolutionary history. However, it evolved in a very historic situation, but we don't live at all in the conditions that we evolved in. So modern contexts like fighting, wars, getting mugged on the street is a very different, and the way we train as well is very different than the way we evolved and grew up. So we're going to have a predictable response for the environment that we evolved in, but it's not the most suited to the modern context we live in. So that's just the biggest thing to keep in mind as you're either experiencing or learning about the combat response. So the physical changes are pretty much the same, and we'll talk about that in a second. The different mental responses are different in everybody. Some people are more suited to just facing and turning into a threat. Probably most of the people here, just because we have an interest in martial arts. Some people just cannot deal with threat at all, and actually shutting down and wetting yourself and acting like you're dead is very effective when faced with a predator, so that's actually a very effective response. So just keep that in mind when it's happening to you, so you know what kind of person you are when faced with threats. And also training can change the kind of person you are. Combat stress also has long-term consequences, mainly based off of the mental aspect. And if sometimes it can lead to post-traumatic stress disorder, most frequently it doesn't, but it can, and that's beyond the scope of this presentation. Yeah. So when you are in a fight, the following things happen, which are going to sound really clinical, unless you've been in a fight and know exactly what I'm talking about. So the sympathetic nervous system activates. That's the part of your body that gears everything up, gets everything going. You've got a big old adrenaline dump. Everyone knows that shock feeling when you've been scared or someone's jumped out at you. That's the start of it. So what happens is that accelerates your heart rate, gets your blood flowing, your nervous system, or your, what's the veins? Respiratory, circulatory system. It tightens up and pulls everything into the core. So if you're getting attacked by a bear, all of a sudden your blood is keeping your organs alive, which are the most important. Your limbs, not so important. Maybe you can lose those. But you keep the core, you're going to be good. So the blood goes into the core, leaves the limbs. Also, your heart rate or your blood pressure increases because everything constricts. So if you are going to get cut, the blood's going to stay inside and not come out. This has the effect of shutting your brain down because the blood is no longer in your extremities, of which your head is one, and it's now in the middle of your body. So your thinking gets a lot more repetitive. It's very hard to articulate what's happening, what's going on. If you've ever been stressed out and you're trying to talk to someone and the words aren't coming out, it's very similar to what's happening there. Unnecessary bodily functions cease. So this is actually very documented throughout history. The Norse and Greek sagas mention bowels turning to water. Your body might drop ballast because it's not useful and it's slowing everything down. I read an account of a couple special forces team in Iraq. They all took a battle crap before they did anything because they knew they just needed to clean the system out, and if it was going to happen later, that was a bad time. I like to pee before tournaments because I don't want to think about that. So,
efforts that too.
Yeah. So this, you will experience when this is happening, visual distortions or tunnel vision. Sometimes people talk about the vision goes red, or they only focus on what thing's going on. They say they saw the person's face and it filled their entire view, or if somebody pulled a weapon and all they could see was the weapon, and they could probably paint it afterwards because they could see the little nicks on the blade and everything. Your brain is doing that to help you out because you're focused now. Your mind is geared toward what that threat is, and then however you're going to get rid of it or eliminate it. People also suffer from auditory exclusion, where you can't hear what's going on. Again, the blood's out of your ears now, so your ears aren't functioning, but you're also focused on what's going on. Anyone who's got in a really good sparring match and didn't hear the ref say stop, that is a side effect of that. This also has a couple negative consequences in modern scenarios where you're in a fight with somebody and all of a sudden law enforcement show up and they're yelling, get off, but you don't hear them because you're focused on something else, and then people get hurt. So yeah, that, not being able to see things, not being able to hear things that aren't in the immediate surrounding, that's something that can be trained. You just keep your head moving, or just stay aware of your surroundings in between rounds. That's how you can train to kind of mitigate that. One of the most important things is that fine motor control disappears when your heart rate increases to 115 beats per minute. That's not set in stone, but that's the range we use. So I couldn't do this if I was fighting somebody because I would lose that ability. However, at 145 beats per minute, my complex motor skills increase. And those are things like maybe a simple trip or swinging a sword that actually gets better as your heart rate goes up.
So shouldn't that say increase of complex motor skills?
I'm sorry, I'm going to fix that. Thanks, Aaron. Sorry, above 115, complex gets better, but above 145, complex goes out the window. So that is, then all you have is gross motor skills. So then the most effective things are things like punches or shoves or throws. So that's why fitness and a certain degree of confidence is necessary to keep your heart rate in that, that sweet spot there, because then you've got, your mind is focused and your motor skills are the best there. I'm going to tweak that for the next time I do this. Okay, I'll start. Cool. Something else that is you don't feel pain, again, because your blood's in their core. So if you get a couple of cuts on your hands or your arms, you're not going to notice that. If you get rocked in the face, you're not going to notice that either, just because things are going on there. And we'll also talk about that later. So the mental side effects. People, when they experience combat stress response, we've heard of the fight or flight, but there's 4 reactions you can have. There's fight, flight, posture, and submission. So fight is you react and you fight. Flight is you run away. Posture is where you try to make yourself real big and scary. We see that on the bar, outside the bars on Friday, Saturday nights. Posture is interesting because someone who's posturing may never fight you, but it's also impossible to know whether they will fight you or not until you actually make contact with them. So you have to treat someone who's posturing like they're about to fight you. It's also important to keep in mind that if you're recognizing the combat response in someone else, they might just be posturing, so you can deal with it that way. And submission is also really effective if you're being attacked by a bear, where you just fall down and pee yourself and hope he goes away. But if you're in a fight with somebody, that's not so effective. So we try to train you away from that. The feedback loop is, again, something that comes out when you're being attacked by a bear, and you just start wailing him in the nose, and you smack him and smack him and smack him, and sometimes he'll go away. That has a bad application sometimes in combat when you're using the one technique you used or you learned in class last week and it's not working, so you keep trying it again and again and again. That is not effective. And we're going to touch on training considerations a little bit. You know what? If everyone can just bear with me, sorry about that. And another interesting side effect of the combat stress response is that your recall of the event can be affected. People often don't remember what happened. They just know there was a fight and now the fight is over. And I'm cut in a few places and the other guy is also cut in a few places and they can't remember what happened. Interestingly enough, this comes back after sleep. It's been noted in law enforcement training that 2 sleep periods is the optimal, so 2 days later is the optimal time for officers to write reports after a serious incident. While that's physiologically the best, that's also not really the best operationally, because if someone just got into a huge scrap, they need to know why right away and have that all documented. But I thought it was very interesting. Okay, so the training considerations for the combat stress response is something we do really well in this club, and something I've noticed on other clubs I've gone to haven't. But the vast majority of your skills should be complex gross motor techniques, and you do them enough so it becomes muscle memory. So if you break down our standard Scheitelhau with the push-pull, that's a complex motor skill technique. But if you're really amped up, you can also just bring the sword down, so that's a gross motor skill technique too. Same thing with our unarmed combat, the locks and throws. They're all mostly complex motor skills, so in times of stress, it's something to fall back on. We train to finish techniques, so you don't just kind of try, hold and stop and see what happens to the other guy. That's effective when you're starting to learn the technique and you're not exactly sure what you're supposed to do, but ideally you keep training to follow up and finish. We usually, when we're doing swords, it's usually do the technique to defend yourself and then always find out where you can stab the other guy in the head from there. It's very important because when your brain's shutting down and you're fighting somebody, you want to do what your training tells you to do. And if your training tells you to stop, you'll stop. If your training tells you to go, you go. The quote I like is, "You never rise to the occasion, you always fall to the level of your training." But training is very good here.
Thank you.
Short-circuiting the feedback loop. Another thing we do very well here is we do multiple finishings from the same technique. So it's not always for hand-to-hand. Say someone punches at you, you block off to the side and get behind them. Johannes always shows us about 5 or 6 different ways what to do when that happens, and he'll show us 5 or 6 different ways how to react to a punch, and 5 or 6 different ways when we step to one side of an individual what to do. So if one thing's not working, try something else. It's really bad to get into the feedback loop where the same thing over and over isn't working, because that is how people die. Fitness is a training consideration, also a personal consideration. The more fit you are, the better you'll be at fighting. And however, the more fit you are is also good for your blood pressure, because your heart rate overall stays low and your body doesn't amp up into the combat state as fast. So if you're staying in that sweet spot of 150 and 145 beats per minute, being in good shape is going to help you stay there and get there. And I think I'll be moving this slide around, but In that sweet spot between 150 and 145 beat per minute, they call it optimal arousal. And they also break down heart rate states into codes or zones, or conditions. So condition white is when you are asleep or not paying attention. Condition yellow is when you are alert and looking around and seeing what's going on. There's no physiological difference between condition white and condition yellow. It's all mental. The analogy I like to use is if a dog is awake, you cannot sneak up on it because dogs are always in condition yellow. Like, dogs sleep, yes, you can sneak up on them there. If your dog is awake, you cannot sneak up on him. Like, does anyone want to argue that with me? I have a dog. I'm sure some of you have dogs. So people are awake but in condition white frequently, and that is something that people, you're just walking down the street daydreaming, checking your phone, listening to music. That is something that people who want to mug you or do violence, they pay attention to that. So if you just get in the habit of looking around wherever you are, don't be a victim, you're a lot less likely to be attacked. So condition yellow turns into condition red, and that's the optimal combat state between 150 and 145 beats per minute. Going from condition yellow into condition red is like switching from second gear into third gear. It's not too bad. Switching from condition white into condition red is going from first to fourth, and that is bad. And that's how you catch a lot of people off guard, and that's also how they amp up during the combat response. And once you're fighting, it's a race to stay in condition red and to try to stay out of condition black, and that's when your heart rate rises above 145 beats per minute and your fitness is getting exhausted. So that's when things stop working, you're getting tired, you may have the will to succeed, but you don't have the energy. This is associated with a bunch of negative things like panic, which is also bad because that just exacerbates things even worse, and that's when you're losing. You can still win a fight when you're in condition black, but that's when the feedback loop is more likely to occur. So, yeah, this isn't the most scientific, but it's just the breakdown there. And just to mention is something called code gray, which is really hard to study because it's incredibly unethical. But a lot of the special forces soldiers report being in a thing called condition gray, where you can pretty much fight forever, and they will be in combat responses for a long, extended period of time. And this is associated with a heart rate of about 175 beats per minute. Elite athletes call this the zone. I'm sure if you've ever had a day where you were either sparring or you were doing your other sport and you just felt on the top of your game, it's called the zone. So it's just something to keep in mind. I think it has a lot to do with just stellar fitness and great training and just like a laser sharp mindset, which I think is kind of just rare to happen in day-to-day occurrence. But that is something I think we should all strive for. Okay, so just the negative, yeah, so the combat response, everyone knows you get scared when you fight and everybody has been startled before, but it's not really common knowledge of how these changes occur. And it was really helpful for me when I first started working in the hospital. I was working about 2 or 3 months in. We took a control tactics course, and a very similar presentation to this was given to me before I had been in any sort of incident that was, exciting. And then later I was in an incident and I recognized these things happening. So it was not too disorienting. I knew to expect it. I think a lot of people that experience it and don't expect it get demoralized. They think they're scared or there's something wrong with them. There's nothing wrong with you because it happens to everybody. Cotton mouth is a thing. If you're trying to talk your way out of a situation, all of a sudden your mouth isn't working, your mouth dries up. That's normal. Let's move on. Trembling of extremities, again, you don't have fine motor control and all your blood's into your core, so you don't have the control of your fingers you like. I had an interesting situation where we were ready to rock and roll with somebody and I thought I was going to fall down because my knees were shaking so hard, and I looked down and my legs weren't moving. It was just weird. So that's something other people might experience. It's hard to keep your thoughts going. It's hard to negotiate with someone. It's just keep in mind too that if you're dealing with an amped up individual, they're also not being very rational. So you can also tailor your response to work with that. So if you've experienced anything of this, that might be happening. People often get confused and think they're scared. It's not fear. Bruce Lee says it's your body telling you it's ready to go. So, just as important, not as in depth, but just as important is after the fight and your sympathetic nervous system is activated and everything's amped up, it has to go down because you can't maintain that forever. The body seeks homeostasis. So the parasympathetic nervous system kicks in and starts reversing all those changes. So all of a sudden your blood's going back to your core, your blood vessels are dilating, blood's going back to your eyes, your brain starts coming up again. And this is kind of traumatic, so you might get dizzy, you might get nauseous. Any wounds you took to extremities are all of a sudden going to start bleeding. People they'll win the fight, they'll kick ass, they took a cut, they notice it's bleeding, and that freaks them out. And then all of a sudden you just start going into shock a lot faster, so it's just something to keep in mind. Actual muscle tremors start happening, your body's starting back up again. And you might be really tired because you just expended a lot of energy in a fight. And you could also have the risk of going into shock. Not very common, but it could happen. So if you are in the backlash, you were in a fight and now you need to recover, the most important thing you can do for yourself is sleep. Sometimes that's not always optimal because it was the beginning of your day and now you have to continue with your day. If you can't do that, at least eat a meal rich in carbohydrates. Your body burned all that energy. Your liver probably did a huge glucose dump and all that sugar is now in your bloodstream and got sucked into your muscles. So just eat something, feel a lot better there. And be aware that the mental effects could occur. There might be some trauma. You're not going to remember what happened until a couple sleep cycles later. It's not like the movies where you all of a sudden just remember things in dreams. It's just the next day if you think about the incident, you'll remember more of it. And there is a risk if it was a really traumatic situation or you weren't at all prepared for it or something you didn't expect at all would ever happen, there is a risk for PTSD. That is not something I am at all qualified to talk about. So I guess the breakdown of this presentation is that combat response is not common knowledge and is often disorienting if it's been experienced for the first time. If you're aware of it and your training is tailored towards it, you can work through the response and probably be okay. It evolved in a very specific historical situation to keep you alive and clearly kept everybody's ancestors alive because we're here today. But it's not always the most appropriate in every modern situation. And it's not your body being scared, it's your body being prepared. And you're gonna kick ass like this knight is gonna kick ass. So I have two case studies in historical situations to demonstrate this working. Aldo Nadi, I'm probably not saying that right, was an Italian fencer in the early 1900s, considered one of the best in the world, kicked ass nonstop at Olympics. He challenged a fencing critic to a duel to the death because the guy said some bad things about him in the newspaper. The fencing critic was not as good a fencer, but had been in duels before. So this is Aldo. This is his sweet lunge that he won a whole bunch of medals with. This is Aldo when he's fighting. He does not look so cool there because he's all balanced, and all of a sudden, what's this leg doing? Shouldn't be doing that at all. He talked about it in his memoirs. He realized what his body was doing, and his mind was powerless to stop it, just because he'd never actually been in a combat situation before, despite being a sport fencer. It is interesting to know that he did win that duel. Nobody died, but they went to first blood, and he made his point. Second case study I liked, Ambrose Pare, I'm probably saying that wrong too. He was a French surgeon to a king in the mid-1500s. I'm not going to read that out loud, but he was observing a bunch of battles, and one of them he saw two people fighting in single combat. One person was struck in the heart. I think he says to the width of your thumb. The guy who was stabbed in the heart chased his opponent for 200 paces, killed him, and then fell down. And when they opened them both up, they were just covered in wounds. So if you can take an insane amount of damage and still finish the other guy off. I didn't include this one because it's not quite a historical case study, but an off-duty female lady cop in the States was mugged by 6 guys. They shot her in the heart, and she killed all 6 of them after being shot in the heart.
Did she survive?
No.
I don't think so.
Everybody died. Or did she? I need to look that one up. That's, I have that book. I will look up. There are cases of people being damaged in the heart and brain and defeating their opponents and surviving them. These are my resources on combat and on killing by David Grossman. Probably one of the best books on this subject. Tim's read it. A bunch of people have read it. Lawrence Kane wrote a book, The Little Black Book of Violence. It talks a lot about just the situations that violence occurs, which is more kind of from a social aspect, like people are more likely to fight if these things are happening. He talks a lot about just like the legal aspects and what's first aid and emergency medical aspects afterwards. Secret History of the Sword by J. Christoph Amberger is a great book. I got a couple of my examples from there. He just really likes sword fighting. He's got a whole bunch of short essays about lots of random historical sword fighting things. And
Which is the famous surgeon Ambrose Parry.
yeah, that guy. His memoirs are very interesting and very long. And that is my presentation. Are there any questions? Things I missed, things I should have talked more about? Cool.
You were talking more about the training and how could we improve on that? That's my big question.
The training, I'm gonna go off on a tangent here. The training and the self-defense, no issues. I think it's been really helpful. Just the way the techniques and the principles are structured, it's always been to teach principles over techniques. I call it the continuum of correctness, where you don't have to nail a technique 100%. Even if you do the principle, you'll still probably be okay. But of course, it is better to do the technique properly. The only issue, and this is kind of just a criticism on the HEMA community as a whole, is that it seems as the community gets more popular, the tournaments become the big thing, and the tournaments, I think, are becoming a little sportified. And then once that happens, there's always the danger that the art becomes to the sport. And if we look at Olympic fencing, that was based off keeping nobles alive as they were dueling each other, and that wouldn't keep anybody alive today in a serious fight. And I don't think HEMA as a group is in danger of that happening, but I just think if people might start changing the training to game the system in the tournament, which is okay if you want to win a lot of tournaments, but there's something to keep in mind too if you're practicing self-defense. Just keep them as separate.
Anything else?
Would it be better to have a little more information on the gray zone?
I can't find any.
Look up sports psychology. You'll find it in there. Because I've done research into it, and I'm aware of what it does to the brain. And it basically like your brain's running on overdrive.
We're gonna talk then. Okay, I have some of his books. I don't think I have that one.
Yeah, and there's some IDF guys who talk about it too. I just can't remember who.
Okay, cool. Because I was actually looking for stuff. I couldn't find any, but that is interesting to me.
If anybody's ever been in a car accident, I'm sure they've noticed the moments where everything seems slow motion.
It took forever.
That is the gray zone.
Yeah.
That's what you're stepping into. It's your brain has accelerated past your body. And your brain is now processing everything so fast. The trick is, what athletes get is they've trained their body enough that their body starts responding. Yeah. And when their body starts responding to the brain signals at that speed, that's what allows them to do the times where you'll see a hockey player and he'll skate through 5 guys like it was nothing. But he could go try it 20 more times after and he wouldn't get past the second guy.
Everybody has the one really good night,
Yeah,
but
and
it's hard to pin
that's
it
exactly
down.
what it is your motor response has caught up to your brain impulse. And that's allowing everything to mesh, and it's just surreal when it's happening because it feels like nothing can touch you.
So I need to do that in tournament in
And
2017.
then as soon as you come off of that, you're just, for like the next 3 weeks, you're going like, why can't I do that again? That was so, and you just feel terrible because you can't replicate it.
This was kind of outside the realm of presentation. Look up a book called Achilles in Vietnam, and the guy takes a bunch of experiences from Vietnam vets and compares it to Achilles when he was in his rampages in the Iliad, and it's just like you look at it and it's a lot like that, because they say they could do anything, they're untouchable because they're so like traumatized. It's not the good gray zone, it's the very bad gray zone.
To somebody watching, they might not see the subtleties of it, but it's that thing where like if I was being attacked with a sword, that little movement was perfect, and there it misses. But at any other time, the responses aren't all there just to know that this is all I needed.
Yeah.
And so it's, oh, and you turn to the next guy and you keep repeating it. And most people, it only lasts for a few seconds, and then it goes away.
Now, do some people function at better zones? Like do some people function better at a calmer state? Do some people function better at a more extreme state?
The zones and conditions are kind of more of a framework. That I don't have too much information about. I think everyone's going to be like a little different when how they are in those conditions, and people that are like most of us don't have a lot of experience with being in that. It's just the people like law enforcement or soldiers that like expect to go into that. They're going to know how they react better.
Might be interesting to learn a little bit more about how to arrive at that state voluntarily.
That's why we warm up.
It's heart rate controlled, so it's getting your heart rate to the right place.
Part of the thing is just knowing yourself and knowing what you do in that state. Like, for myself, I know that I avoid the high level states on purpose. Because when I get into them, I hurt people. So I avoid them.
I don't think it's so much about trying to enter them, it's more about learning to control yourself once you're there too. Like it's like what you have a harder time with, so you just keep yourself out of.
Yeah, yeah. But that's because I've been in them enough to know.
So
if you ever get the chance to talk to a really high-end athlete about it, they'll all tell you the same thing. They don't control when they go. They just know how to respond once they're there. And that just comes from repeating the actions over and over and over until your body can do them at the speed your mind's thinking in that state.
We've all been in those fights where someone goes, "Wow, that was great! That was great! Do it again!" What did you do? I don't know. I'm not sure.
I think it must be possible to do it though, because certainly you read in the old Norse sagas about how berserkers would work themselves up into a berserker.
Yeah, and they're not the only ones who've written about it, that you can control going into the state. It's coming out of it that's hard.
There certainly is. It's heart rate based and excitement based and adrenaline based, so it's all about getting those things flowing. And clearly those people who fought for a living as part of their life learn to do that because it's part of their survival. In a modern setting, the closest we have to it is special forces or super high-end athletes.
Yeah. Or Sam. Shakes his head.
You'll go, like, a clear example of just a moment of it happening, and I'll just use this one because it comes to mind clearly, is the first NHL game Jordan Eberle played in. They were shorthanded, and he basically stripped the entire Calgary Flames and made it look easy. In the multiple years he's played since then, I've never seen him be able to repeat that exact feat. And he's tried it several times, but it just doesn't happen. And that was a moment where everything kicked in. The excitement was there. It was his first game. The heart rate was way up, and everything happened. And then after, it's kind of like, what did I do?
Perfect storm of brain chemistry.
Yeah, and even he said after, is like, he had to watch videos to understand what he did. And it was, the exact thing he did was a move that he had practiced thousands and thousands and thousands of times. It was nothing special, but it was just in that moment, the way everything worked out, it became something special.